the World Health Organization now declaring monkeypox a global health emergency, even in light of what could be described very, very accurately as a very, very small number of cases. The classification of health emergency is because there are concerns it could spread further, and that would require a coordinated global response. But that doesn't mean any of us should panic. There are just about 16,000 cases globally in 75 countries. Europe is considered the epicenter of this outbreak, if you want to call it that. In the U.S., there are more than 2,800 cases in 44 states and D.C., New York reporting the most cases. We want to bring in Dr. Dean Winslow, infectious disease specialist, who is also a professor of medicine at Stanford University. You've got to help make it plain to so many people who are listening to this. With all of the skepticism about the medical leaders in our country following the past couple of years, to deem monkeypox, where you have fewer than 1% of 1% of the world's population infected. I mean, the numbers are minute compared to the global population or the American population. Why would this be deemed a global health emergency?
Yeah. Apparently, it was a little bit controversial at WHO's meeting as to declare it a public health emergency or not. But I think many of us in infectious disease feel it was appropriate, because at least this allows more resources to be put into looking at the epidemiology and getting treatments out there and vaccines available to treat individuals who are exposed. And, remember that the U.S. government and other governments were actually criticized somewhat fairly for probably not declaring a public health emergency sooner when COVID-19 hit back in early 2020.
But isn't that apples and oranges? Because the way that you contract monkeypox is very, very different than how the first strains of COVID were contracted. So why don't we talk about that? How do you actually get infected?
Absolutely. That's a great point that you make. And again, one of the things that I like to try to reassure people about is that monkeypox is really not a threat to the majority of individuals, since it requires very close contact between individuals to have it spread. So it's not like something that you could pick up by just riding with someone in an elevator.
Can you get it by kissing?
You certainly can, and that's real important. And one of the things, giving this, unsolicited advice is that, I think it's also real important that, we don't stigmatize, gay individuals because some of the early cases outside of Africa have occurred in that population. But like with any virus, it really does not discriminate. And so it potentially could be spread, truly to anyone. Again, by close contact, including kissing or direct skin-to-skin contact. And
it's that skin-to-skin contact that makes this a different kind of scenario than the COVID pandemic. And so I think that people are very skeptical when they call this a global health emergency, when this is going to require people who are touching physically or exchanging some type of bodily fluid, I guess. You mentioned kissing. So how is the response when they decide to deem this, and you said this was an that word is so big for me, epidemiology question. When it's about how we respond to something like this, what kind of resources will be used to try to stop further spread?
Well, again, the resources themselves, are determined country by country and even county health department by county health department. So, the WHO is largely an advisory body that, that does, though, have some capability of coordinating different national health authorities. But, the actual resources, will not come from the UN and the WHO, but rather, I think how each individual country and jurisdiction within those countries really chooses to respond. But I think that the decision made by Dr. Tedros to declare this an emergency was primarily to just increase attention to this disease.
Well, hopefully attention, but not fear and widespread panic over something that most people are not at risk for contracting. And again, obviously, we want everyone to be safe and everyone to be healthy. And that's the wish for all of our family members and loved ones and neighbors. Thank you, Dr. Dean Winslow. Really good conversation. Appreciate you joining us.
You're quite welcome, ma'am. Have a great day.
You too. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.